Hi, thank you for joining me today. My name is Stephanie Carpenter, and I'm the Medical Director for Palliative Medicine of Southern Maryland, which is a division of Calvert Hospice. Today, I have the opportunity to talk to you about palliative medicine, and I'm so excited. I hope at the end of this discussion, you'll be able to define what palliative medicine is. You'll know the difference between palliative medicine and hospice care. You'll have a really good idea of what a palliative consult looks like. You'll understand the team members involved. You'll be able to identify the location of our services. And ultimately, you'll see the impact of palliative medicine. So what is palliative care? Well, it's specialized care for people living with a serious illness. This type of care is focused on providing relief from the symptoms and stress of the illness. And the goal is to improve quality of life for both the patient and the family. Well, those are a lot of words. So what does that mean? This is specialized care for people who have serious chronic illnesses. That means illnesses that will never go away. Things like cancer, or congestive heart failure, or kidney disease, or dementia, just to name a few. And what palliative care does is it manages the symptoms that are created by these illnesses. Symptoms like pain, or shortness of breath, or anxiety, anorexia, insomnia, you name it. Anything that causes a decreased quality of life is what palliative care addresses. It's based on the needs of the patient and not a patient's prognosis. It's appropriate at any age and at any stage in a serious illness, and it can be provided along with curative treatment. Palliative care sees the person beyond the disease. It's a fundamental shift in healthcare delivery. So I want to identify the differences between palliative care and hospice services. The main difference is that hospice care is provided for those individuals who have a prognosis of 6 months or less. Palliative services are offered at any stage of a disease or illness. For hospice care, the pursuit of curative treatment must be stopped. For palliative care and palliative medicine, it's provided in conjunction with curative treatment. Hospice services are provided for the most part in a home environment. And palliative care services in Calvert County are rarely provided in the home, but they may be provided in other care, at other care levels. Palliative care does not replace chronic pain management, whereas hospice does replace chronic pain management. The reimbursement between the two is different. Generally, there is more information out there about hospice services as opposed to palliative services. Hospice services entail a complete team of providers to care for an individual. That team consists of an aide, a volunteer, a social worker, a chaplain. It includes durable medical equipment. It allows access 24 hours a day, 7 days a week to care. Whereas in palliative care, there's no aide, there's no volunteer, there's no durable medical equipment acutely available. And the services are offered Monday through Friday, 9 a.m. to 5 p.m. So what does a palliative care consult look like? These are extensive consults. The time is devoted to family meetings and patient and family counseling. And what happens during those meetings is that the provider gathers all the information about an individual and their diseases and has a conversation about them, where somebody is in their disease state currently, what it looks like in the future, and what interventions may be offered along the way, and what the outcome of those interventions may look like. These consults are skilled communication about what a patient's goals are and how medical care can be tailored to meet those goals. The consult consists of expert management of complex physical and emotional symptoms like pain, depression, anxiety, loss of appetite, nausea, constipation. And ultimately, there's a coordination between all specialists working with an individual, primary care providers, cardiologists, nephrologists, to make sure that everyone is on the same page and that page is toward the patient's goals. So who is the team that makes up palliative care? First of all, the patient or the individual consulting the services is the center of the team. Then there is a provider, a physician or a nurse practitioner, a chaplain, a social worker, and in our case, a palliative care coordinator who makes sure that all the information is received by the treating team and all the information is disseminated to the patient's global team, their primary care, their subspecialists. In Calvert County, you can access palliative medicine if you're a patient at Calvert Health Medical Center. There are palliative services within the 3 nursing centers in the county, Calvert County Nursing Center, Solomon's Nursing Center, and Asbury Solomon's Community. And then we have 2 outpatient locations embedded in Calvert Internal Medicine Group at the Prince Frederick location as well as in Solomon's. Next, I'd like you to hear Debbie's story. She gives a really good example of what palliative care can do and did for her.
Neuropathy it's a type of nerve damage. It affected my feet, my hands, and that's how I make my money. So I've been out of work for more than a year and a half.
I met Debbie when she came into the hospital with an acute pain crisis. She was really going through a lot in terms of just living with this new diagnosis, and then to be suffering from symptoms sort of related to the treatment so that she can live with the diagnosis.
With me being in the pain, I just shut myself out and just stayed in my room. The most they saw of me was to come out and get something to eat and go to the bathroom.
She was really crippled by this neuropathy. And you see, she does hair, and that was one of the things that came out when we were in the hospital. You know, sort of what bothers you the most about this pain.
They talk to one another and they come and they talk to me with each other. Not, they're talking just in a conference among themselves, but they include me in that conference that they're having with one another in terms of the medication I'm on, how I'm treating, how's the medication treating me, how I'm sleeping, how is my quality of life.
I mean, she's such a beautiful person and so lovely and social, and you can imagine for her not to be in that world, it really robs her not just of, financial security, but her identity. And I think it's powerful to think that if you can give her some of that back by controlling her pain, you're really allowing the miracle of her treatment for her myeloma to fully realize itself.
I would not be back sitting in this chair right now if it wasn't for the program. I would be lost without them right now, lost.
She's a perfect example of how palliative care can help.
I feel I'm in the driver's seat because they're really concerned with how I'm feeling.
So what is the significance of palliative care? For the team that's working in the hospital, They improve patient and family satisfaction. They help to reduce 30-day readmission rates. They reduce ICU utilization, and they reduce the hospital length of stay. For palliative care teams working in home-based programs or nursing homes or clinics, they reduce emergency department visits, they reduce hospital admissions and readmissions, and they provide point of care intervention. So if you're having something going on, palliative can intervene and prevent that hospitalization. So if you find that you have a need for palliative, or you know a family member or a friend that may benefit, palliative care can be contacted Monday through Friday, 9 a.m. to 5 p.m. at 410-535-0412. We're located on Merrimack Court in Prince Frederick, Maryland. Please feel free to reach out to us if you need us.